Welcome to another episode from the Addiction Education series presented by the Cardinal Crew Foundation. I'm Dr. Stephanie Brode, and today we're going to be talking about screening for alcohol use disorder. When you come into the primary care setting, you typically meet with the medical assistant who asks you a series of questions. Some of the questions involved in that series is the Audit C, which is the Alcohol Use Disorders Identification Test. It's comprised of 3 questions. How often do you have a drink containing alcohol? How many drinks of alcohol do you have on a day that you're typically drinking? And how often do you have 6 drinks or more on an occasion? The answers from that screening test are then scored based on a point system. If you have 3 points or more, that is a positive screening test. Now, there is a longer version of this test just called the audit, which will typically be employed if you do score positively on a test like this one. If you score positively on a shorter questionnaire, you may be given something called the CAGE questionnaire. It's comprised of 4 questions, and they are: have you ever felt the need to cut down on your drinking? Do you feel annoyed by people complaining about your drinking? Do you ever feel guilty about your drinking? And do you ever need an eye opener in the morning to relieve shakiness or tremors? Now, if you answered yes to 2 of these questions, that is a positive screening test. So this is just the beginning and an opening to the conversation. If you do score positively, typically there will be a longer discussion and see if the diagnosis of alcohol use disorder does apply to you. And if it does, then there can be discussions regarding treatment. So tune in the following weeks so we can go a little bit deeper into the diagnosis and the treatments of alcohol use disorder.